Hi, my name is Miracle Basie, and I will be presenting my final project on predictive modeling. This presentation was prepared for the HAP 671 course as part of the Master's Program for Health Informatics at George Mason University. If uncontrolled, diabetes can damage your heart, blood vessels, eyes, kidneys, and nerves. This is why it is so important for patients to get screened for diabetes and take steps to prevent it if the patient's medical history identifies them as high risk for diabetes. By optimizing electronic health records, physicians are able to more easily identify these high-risk patients, and according to an article published by Healthline, 29.1 million people in the United States have diabetes, but 8.1 million may be undiagnosed and unaware of their condition. The simulated data used in my final project was extracted from a major healthcare institution in the United States. After this extracted data was combined and cleaned, the resulting number of unique patients and the number of records on these patients were calculated. As I previously mentioned in this presentation, the optimization of electronic health records allows for the identification or prediction of patients at risk of diabetes based on the information provided within these records. Diabetes, in regard to my final project, was defined by using the Agency for Healthcare Research and Quality Clinical Classification System. By utilizing clinical classification software codes, the prediction for risk of diabetes was calculated. The total number of diagnoses that had at least 29 observations was calculated. In order to calculate this number, a comprehensive set of diagnoses was used to predict the presence of diabetes or the risk for diabetes. Obvious predictors that always occur with diabetes were identified based on the number of diagnoses associated with the various ICD codes and likelihood ratios. Examples of these predictors are listed on the left, which include hypertension, coronary artery disease, etc. The Bayes model was used to aggregate data from individual diagnoses to overall risk for diabetes. This slide is an example of a case with 5 diagnoses, corresponding likelihood ratio, and calculated odds of diabetes. Using the entire dataset, a random number was assigned to each patient ID. 80% of the random data was chosen and used for the training dataset, while the other 20% was used for the validation dataset. Cutoff values, specificity, and sensitivity was evaluated. The receiver operating curve was created using 1 minus specificity. The receiver operating curve is used to test predictive accuracy. There is a high value in having the correct tools and techniques to accurately identify and predict the risk of patients with diabetes. The usage of techniques such as SQL can better assist physicians with diagnosing patients who are unaware that they have this condition, as well as diagnosing patients in a more timely manner. Additionally, techniques such as SQL can better assist physicians in pre-diabetes management.